Good evening to everyone present here with us today. This is Shriyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by your keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Sarat Kumar. Sir is MBBS MS UK, DRCOG UK, PhD, super specialist in sexology and infertility. Dr. Sarath is in Dr. Sarath Men's Clinic. Sir is also a director of Mediwave Fertility Research Hospital. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is testosterone crisis in young men. Now, without any further delay, I would like to hand over the session to Sir so that he can begin with his talk. Over to you, Sir.
So thank you, Shreyas, for a nice introduction. Good evening, doctors and all the professional colleagues and all the IJCP staff and colleagues. So I'm very happy to be associated with you. Today's evening topic is testosterone crisis in young men. Is modern lifestyle silently castrating male health? So this is Men Health Day, International Men Health Day. That is 19th of November every year. It is celebrated as Men's Health. So, very appropriately, IJCP has selected this topic to discuss the testosterone crisis, especially in young men, in the context of modern lifestyle. Is it silently castrating? Castrating, that is decreasing the testosterone output in young men because of these lifestyle modifications of young men. These are the things which we are going to discuss today. And without wasting any of your time, I am going to talk to this subject under the following chapters: introduction, testosterone, mild hypogonadism causes, diagnosis, hormone levels, testosterone replacement therapy, indications, contraindications, and summary. So, coming to modern lifestyle causing sexual dysfunction in men. Modern lifestyle is filled with demands, expectations, and pressures that can significantly impact the male sexual health. Stress, a common factor, can lead to conditions like erectile dysfunction and loss of libido. High cortisol levels from stress can interfere with testosterone production, which is crucial for libido. So, friends, this is the one thing which I want to press it again. So, what happens is the change in the lifestyle, that is the modern lifestyle, it causes so many things in men, especially it interferes with the testosterone production, which is crucial for libido. To combat these issues, maintain a balanced diet, regular exercise, managing stress, and prioritizing sleep essentials are essential. Additionally, seeking professional support and addressing any underlying health issue can help to restore the sexual health being. So, what are the modern lifestyles which are affecting the sexual health? What are the things which can negatively affect the sexual health and male fertility? Cigarette smoking, the first and foremost, excessive alcohol intake, stressful jobs, inadequate physical activity because of continuous working 14 hours, 18 hours per day, unequilibrated diet, that is that very rich in certain things, very low in certain things, pizza, burgers, non-vegetarian dishes with the lack of vegetables can lead to obesity. And use of laptops, mobile phones, portable electronic devices, tabs, and other things. These can affect the male reproductive system through multiple mechanisms. So, added to this, environmental factors because of the modern life, living in mega cities, metros, has got so many environmental factors. Modern man is often exposed to environmental factors independent of his ill. He cannot change these environmental factors. They consist of air pollution, vehicles, excessive vehicles, exposure to heat or toxins in his workplace, or the presence of harmful chemicals in the food, beverages, agricultural and industrial products. These are all the environmental factors, so it adds to the insult which is already there. The susceptibility to these factors depends on genetic and epigenetic predisposition, potentiality present systemic diseases and medications and local affections and genitourinary system. So, fertility disturbances. The multifaceted nature of both causative factors, that is, the lifestyle modifications as well as the environmental factors, and the susceptibility background makes a resulting fertility disturbance highly individual and variable among different men exposed to these conditions. This lecture critically reviews the current knowledge of different causative and susceptibility factors with a special attention to the molecular mechanism of their action. Finally, this lecture will give strategies for prevention of abnormalities due to lifestyle and environmental factors and available treatment modalities for already present abnormalities are exposed. So, low testosterone. Low testosterone, also known as male hypogonadism, occurs when the body does not produce sufficient testosterone, the primary male sex hormone. While testosterone level naturally decreases with age, young men can also experience low testosterone due to various factors, which I have already told, that is, change in lifestyle and exposure to the toxic environments. So, including genetic conditions, health issues, and lifestyle changes. So, other causes of low testosterone are primary hypogonadism, which is caused by congenital conditions, secondary hypogonadism caused by obesity, diabetes, and other medications, which are also due to contributed by the change in the environmental factors and change in the lifestyle. So, lifestyle factors, poor diet, lack of exercise, substance abuse, exposure to environmental toxins, smoking, alcohol, all will cause low testosterone in young men. What are the symptoms of low testosterone? Decreased libido, significant drop in the sex drive, erectile dysfunction, fatigue, reduced muscle mass, increased body fat, mood changes, depression, irritability. They are all the symptoms of low testosterone. And what is the effect on fertility? That is, effect on semen. There has been continuous decline in semen quality, including a decrease in semen volume, sperm count, concentration, and the percentage of normal forms over the last decades. This trend is supposed to be due to negative influence of widespread lifestyle-related habits to which the modern man is exposed during the reproductive period. Basically, a spermatozoon consists of sperm head and a sperm tile. The head contains the sperm nucleus with its DNA and is covered by the acrosome. The main functional parts of the sperm tile are the midpiece and the principal tile. Mitochondria contained in the midpiece produce energy in the form of adenosine triphosphate, which is mainly used to sustain propulsive forces for sperm cell movement and are generated in the axoneme of the principal piece. In addition to ATP, is used to power the energy-consuming sperm functions such as exocytes, sperm acrosome required for sperm penetration into the oocyte. Harmful external factors can directly affect on the spermatosome and nucleus DNA. They can also disturb mitochondrial function, leading to oxidative stress, which in turn feeds back into mitochondrial integrity and aggravates nuclear and acrosomal damage. Friends, without taking much of your head regarding this, all these technical things, one thing I can tell is it does affect on the semen quality and quantity. So any external factors, that is environment factors as well as the lifestyle modifications, can affect this semen quality and quantity. The next one is the cigarette smoking. Tobacco smoke is a toxic and carcinogenic mixture of more than 5,000 toxic chemicals, some of which include nicotine and its metabolites, carbon monoxide, benzoprene, cadmium, may have harmful effect on the male germ cells. It is associated with reduced sperm count, motility, as well as overall deterioration on semen quantity and quality. Alcohol intake. Chronic heavy drinking linked to low testosterone level, leading to impaired semen quality, while moderate alcohol consumption may not have significant adverse effect. Daily use of alcohol by men of reproductive age was shown to affect semen volume, quantity, quality, morphology, to cause hormonal imbalance, and it can prolong the length of getting the wife pregnant, or it may lead to subfertility and infertility. The mechanism of action of the alcohol, damaging the impact of alcohol and fertility, are not yet fully discovered. Alcohol drinking was reported to cause a hormonal shift towards a higher free estradiol, free testosterone ratio, and to augment the level of reactive oxygen species and DNA damage in male germ cells. So, in a nutshell, I would just like to tell you that alcohol does have a negative effect on the fertility of the men as well as women. Psychological stress. Stress can result from both physical and psychological conditions. Prolonged exposure to psychological stress can reduce testosterone levels, impair sperm production, and decrease libido, in addition to promoting acquisition of unhealthy behaviors such as poor diet, lack of exercise, smoking, and excessive alcohol consumption. So this is a vicious cycle. A person who has got lot of stress will go for smoking, will go for the alcohol, and he will reduce the exercise, he will stop doing his exercise, and again continue to smoke and drink, and this vicious cycle leads to a lot of psychological and physical stress. Elevated levels of stress hormones, particularly cortisol, were shown to interfere with the secretion of gonadotrophic releasing hormone and from the hypothalamus, that decreasing the release of the pituitary gland luteinizing hormone and follicular stimulating hormone. And these are essential for stimulating the testicles to produce testosterone needed for spermatogenesis. High cortisol levels can also make germ cells more vulnerable to oxidative stress, causing sperm DNA damage and reduction in sperm motility and viability. Friends, in a nutshell, stress does cause effect on the sperm quality and quantity. Inadequate physical activity. Research suggests that both insufficient and excessive physical activity, that is, even say severe exercise as well as low exercise, can affect male fertility issue. Although connection with male fertility is complex and multifaceted. Resistance exercise training was reported to improve markers of male fertility and produce capacity in infertile patients, while excessive exercise, such as intensive training for marathons or Olympic events, can potentially lower the testosterone level, reduce the sperm quality and sperm quantity. So, friends, those who want to build a body and go to gym 2, 3, 4 hours per day, go for heavy exercise, go for marathon, Olympic event, can have negative effect on the fertility of the person. Inappropriate levels of physical exercise attenuates inflammation as reflected by reduced seminal pro-inflammatory cytokines, decreased levels of oxidative stress markers, and enhance the production of antioxidants. So, mild to moderate exercise is very, very important. Very severe exercise is dangerous for the fertility, and no exercise is also equally harmful for the sperm production. Use of mobile phones, laptops, and all the tabs and other things. Mobile telephones and other similar electronic devices may affect fertility through a thermal effect and a non thermal effect. The thermal effect is related to the fact that mobile phones are often carried in the trouser pocket near the external jail male reproductive organs, and portable computers are often placed on the user's lap, that is, laptop computers. The consequences of testis exposure to the heat. So continuously, if you keep the laptop on your lap and near the groin, it will the heat generated by the laptop are directly transmitted into the testis. As you know very well that the scrotum should be always minus 2 degrees centigrade from the body temperature. That is, it should be lower than the body temperature. Heating the testis will have negative effect on the sperm production, quality, quantity, and morphology. Other electronic devices, non-thermal effect of portable electronic devices are due to low-level radio frequency electromagnetic fields. They are directly transferred to the body. A meta-analysis of 10 studies, including 1,492 samples, has concluded that exposure to radio frequency electromagnetic fields negatively affect the parameters of human sperm quality, mainly sperm motility and viability, while effects on sperm concentration are unequivocal. So, in a nutshell, the laptops and mobiles, they have negative effect on the male fertility. Coming to testosterone, it's a hormone that gonads mainly produce. More specifically, both testicles and ovaries produce. Adrenal glands also produce hormone dehydroepiandrosterone, which your body transforms into testosterone and androgen. Testosterone is the main androgen, meaning it stimulates the development of male characteristics. Levels of testosterone are naturally much higher in males. So, natural testosterone is a steroid, an anabolic androgenic steroid. Anabolic refers to muscle building, androgenic refers to increased male sexual characters. The term anabolic steroids are generally referred to as synthetic lab-made variations in testosterone that are injected into your body. Healthcare providers are use synthetic testosterone to treat and manage various medical conditions. Synthetic testosterone is the main drug of masculinizing hormone therapy. So, what are the functions of testosterone? Sexual function, libido, and gives body hair, mustache, beard, my hairs over all the parts of the body, and they help in muscle development, and they are very useful for cognition function of the brain also. In adult male, testosterone is essential for sperm production, signals to make new blood cells, ensures bones and muscles stay strong, enhances libido, sex drive, and sense of well-being. So once that testosterone is decreased, it results in so many dysfunctions, that is called as male hypogonadism. Male hypogonadism is defined as failure of the testes to produce normal amount of testosterone combined with signs and symptoms of androgen deficiency. Systemic testosterone levels fall every year by in men. Therefore, increasing longevity and aging of the population, the number of older men with testosterone will increase substantially over the next several decades. Hormonal levels, in a healthy person, the hormonal levels below 215 nanogram per deciliter is considered as hypogonadism. So this is the normal testosterone level. The peak testosterone level will be between 7 a.m. to 10 a.m. and that is the time we have to measure the hormonal levels. Heavy alcohol consumption decreases the serum testosterone. Smokers have a total free testosterone level 5 to 15 times higher than the non-smokers. That is free testosterone, not the biologically active testosterone. Serum testosterone is unbound, is free. Total testosterone, the low limit of normal range is 315 nanogram per deciliter. Free testosterone index total is T by TSG. Coming to treatment, how to treat a person who has got low testosterone level, that is hypogonadism. It should be treated with testosterone replacement therapy, that is TRT, also called as HRT, hormone replacement therapy. Other than hormone replacement therapy, the lifestyle modifications, improving the diet, increasing the exercise, yoga, diet, management of the weight can positively impact the testosterone level. And testosterone can be given in various types of administration. TRT can it is available in various modalities: intramuscular injections, patch, gel, bioadhesive buccal, oral testosterone, pellets, sprays are all available. Patient received testosterone treatment should be reevaluated 3 months after the testosterone initiation and at least annually thereafterwards. You should not go on giving the TRT without examining the patient and measuring the testosterone levels. And before giving the TRT, you should make a proper diagnosis, measure the total testosterone, know what is the normal. If it is normal, 300 nanogram per deciliter, follow it up. If it is low, give testosterone therapy. Treatment symptomatic men with 300 nanogram or low, some favor 200 nanogram per deciliter and low. I prefer 300 nanogram per deciliter as the cutoff point to start the treatment in those who are symptomatic, those who have come for erectile dysfunction and other symptoms of hypogonadism. In either case, men with classical androgen deficiency signs and symptoms accompanied by persistent low testosterone, testosterone replacement there is recommended to improve the sexual function and bone marrow density and sense of well-being and to induce maintain secondary sex characters. So these are the benefits of TRT before there is increased risk of Alzheimer's disease, constant fatigue, depression, increased fat, increased risk of erectile dysfunction, low libido, increased risk of osteoporosis. After starting the TRT, sharper mind, confidence, healthy heart, strong erections, and strong bones, high energy. So there are several types of TRT: intramuscular injections, gels, mucoadhesive material applied to the teeth, long-acting subcutaneous pellets, oral medications, testosterone stick. Nowadays, testosterone spray has also come. Testosterone esters are available. The IM injections, ethanate are available. Injecting long-acting testosterone injections are all available. Andiconate injections are also available. Non-genital transdermal physiological circadian T levels, no skin irritation. So it is available in various forms, injections and patches. Patches, gels, and sprays, they are also available. Patches, good addition, normal DHT levels. Scrotal patches are also available. Testosterone gels are easy to apply, and we can. They have got muscoda. Children should not touch these testosterone gel. You should not take the child on your lap when you apply the testosterone because it can be transmitted into the skin. Buccal pellets, biodesive pellets, and testosterone pellets, they are all available and they can be used. Even nasal spray is also available. So, misuse of testosterone, some athletes and bodybuilders misuse this synthetic testosterone, taking it as anabolic steroids by taking very high doses of them in an attempt to boost performance or change their physical appearance. Misuse of these drugs can cause several unpleasant symptoms and lead to long-term dangerous health problems, including blood clots, stroke, and potentially increased risk of prostate cancer. So, to conclude, recognizing the sign of low testosterone in young men is crucial for timely diagnosis and treatment. Modern lifestyle changes have resulted in low testosterone in young men. If you suspect low testosterone, it is important to consult a healthcare provider and measure the testosterone and take appropriate testing and management and go for TRT if required. Early intervention can help prevent long-term health issues and improve the overall quality of life. Lifestyle modifications, diet, exercise, yoga, meditation, they are all very, very important in this one. Quitting the smoking is very important. Decreasing the alcohol consumption is equally important, and exposure to the laptop should be decreased, and exposure to too many gadgets, electronic gadgets, should be decreased. Use of the mobile phones, keeping the mobile phone near the groin should be avoided, and taking appropriate measures to use the electronic gadgets in an appropriate way will in long run go. Instead of laptop, always use the computers or desk computers are excellent because they will not cause the transmission of heat into your brain. So keep the mobile phones away when you are not in use. So these activities in long run will definitely decrease the radio frequency effect of these mobile phones and the excessive heat of these computers transmitting it to you. And most important thing is lifestyle modification and decrease the weight if we are already obese. So thank you very much once again. Happy Men's Day, International Men's Day. I sincerely thank the IJCP authorities and today's moderator Shreyus for nice introduction and for giving me an opportunity to address you enlightened people. And I sincerely thank you for your patient hearing. And over to Shreyas for further moderations. And if there are any questions, I'll be extremely happy to answer. Over to Shreyas.
Thank you, sir. Thank you so much for this wonderful presentation. We do have some question if you like to take that up.
Yeah.
So the first question from our audience is, what are the most common psychological cause of low testosterone in men under 40?
Yeah, the most important the signs and symptoms of low testosterone are, the first one is fatigue. The young man who was so energetic starts feeling that he's drained off. He doesn't have much energy. He loses interest in the activities, surrounding activities. That is fatigue. Second is loss of libido, sex drive. Earlier, we used to have sex almost every day or sometimes twice a day. And nowadays, he feels that he is exhausted. He no longer craves for this sex. That is loss of desire, loss of sexual activity, decreased libido. Third thing is erectile dysfunction. Earlier, the same man, young man, who used to get steel hard erection, feels that his erection has come down. The rigidity of the penis has come down. The penis is shrinking. The testicles are shrinking. So there is muscle mass. The man who was looking very, very manly now feels that his biceps are coming down, thigh muscles are thinning out, and osteoporosis. The bones are starting losing the this one. And cognition. Earlier, the mind was so sharp, react quickly. Now he feels that the brain is not acting that quickly. He is thinking that he has got lots of memories, unable to they memorize whatever things, and he starts forgetting the things. So these are the signs and symptoms of hypogonadism from in young men due to lifestyle modifications and exposure to these environmental hazards.
Thank you, sir. Next up, we have how do obesity, metabolic
Yeah.
syndrome, and insulin resistance psychologically impact testosterone level?
Yeah, very good question. Obesity, the cholesterol is the precursor of these hormones, that is estrogen and progesterone. So, obesity, what happens? The fat is converted more into the cortisols, and these cortisols are precursors of the hormones, that is the testosterone and estrogen. So, unfortunately, estrogen level goes on increasing in men who are obese. So, the estrogen, instead of testosterone, estrogen level increases, and that leads to loss of libido and loss of desire. There is imbalance between the testosterone and estrogen level in men with obesity. And another thing with obesity is because of the high triglycerides and increased cholesterol level in the men with obesity, these triglycerides and cholesterol, they form plaque in the blood vessels, and that reduces the blood supply, especially to the testis and to the penis. So decreased blood supply to the testis shrinks the testicular volume and decreases the testosterone level, and decreased blood supply to the penis by decreased the penile artery diameter. It results in shrinkage of the penis, and also it results in erectile dysfunction. So obesity directly and indirectly affects the fertility as well as the sexuality.
Thank you. So, there's one last question. What are
Yeah,
the common clinical signs of early onset of hypogonadism that
yeah,
clinician might overlook?
yeah. The first and foremost is, of course, loss of libido and fatigue. So early signs of hypogonadism are loss of libido and fatigue. The person who was highly energetic, for example, an young entrepreneur, age 32 years, he was so young, enthusiastic, used to work 14, 16, 18 hours per day. Now suddenly feels that he is exhausted, is drained off. So what happens is when he is drained off and exhausted, he feels fatigue, and that fatigue leads to the loss of energy, and he feels weak. Muscles become weak, bones become weak, and cognition, that is his thinking capacity, decreases. He starts forgetting the things, and the sex drive is decreased. So early signs of hypogonadism due to lifestyle modifications and exposure to these environmental hazards are the fatigue and loss of desire, loss of libido.
Understood, sir. Thank you so much for explaining such wonderfully. That's all from our audience, sir. There's
Yeah.
no further question. Before concluding, sir, any take home message from your end?
Yeah, yeah. So thank you, Shan. Thank you for an opportunity, and I sincerely thank the IJCP authorities for giving such a wonderful opportunity to address all our doctors in the nook and corner of our country. And this is the one of the largest platform where we distribute the knowledge so that those who are in the remote places also get the complete up-to-date knowledge about the latest affairs in the medical field. And on this International Men's Day, I would like to convey one thing, that is the men's sexual health is very, very important for the propagation of the population. Unless the men's sexual health is kept properly, they can result in the loss of desire, loss of libido, erectile dysfunction, and decreases semen parameters, decrease semen volume, quality, and quantity, resulting in the subfertility and infertility. And infertility in the couple leads to a lot of family complications. They have to go for IUI, IVF for getting the child. That adds to stress to the woman, and also a lot of inconvenience to the woman, because she has to undergo a lot of treatment for producing the child, which should have come normally by the male. So because of the male hypogonadism, male factors, she is the one who is going to suffer. This leads to a lot of economical burden on the family, and family fights and family disturbances. The in-laws come to the picture. They start blaming the female partner. They never think that it is the male partner who has the cause for the infertility. They think that it is the woman who has done something wrong and she is not becoming pregnant. So this results in family, and interpersonal relationship problem, adds to the stress, the economical stress and physical stress, mental stress, biological stress. So to overcome all these things, the men, they should take care of themselves, keep away from hazards, smoking, alcohol, drug abuse, and also sedentary life. Start doing diet, exercise, lose the weight if they are already obese, and do the yoga, meditation. Keep away from hazardous chemical toxins and exposure, reduce the possible exposure to these environmental hazards. So try to go in the public transports instead of using the two-wheeler, where the exposure to the hazards will be more. Going by metro, the hazards, exposure to the hazards is very, very negligible instead of going. For example, from my place, from Rajajinagar, if I want to go to the Whitefield, I have to by taxi or car or by two-wheeler. It takes nearly 90 minutes to 120 minutes, whereas I can reach by 35 minutes by metro. And metros are all fully air conditioned, pollution free. Even metro stations are placed at a higher level, and the air pollution level is very, very low in metro stations. So use public transport so that the hazards are reduced. Pool the car so that three, four people, if you go together, your contribution to the pollution will be decreased. And even in the workplace, try to use less of laptops, less of tabs, less of mobiles. Try to use landlines. Try to go back to your basic arithmetics. Try to use the computers, regular computer, desk top computers. All these measures will keep your sexual health normal, and keep you away from subfertility and infertility and other sexual dysfunctions. So thank you very much. If there are any questions, email me. Shivaratri. Thank you, Sriyan, for wonderful
Thank you, sir.
introduction.
Thank you
Good
so
night.
much for joining
Goodbye.
us today, sir. Thank you. Thank you so much. Good night, sir.